The Bear River Health Department is getting some extra help for infected patients who have nowhere else to go. Some empty dorms at Utah State University are now being used as a place to help those people isolate and maybe slow the spread. Northern Utah specialist Mike Anderson spoke with one man who says that option made a big difference for his family. Mike?
Yeah, Mike, it's a pretty solitary arrangement, possibly more so than isolating at home. But for some people with unique circumstances, those dorms can be a big help.
In the fight against COVID-19,
I experienced all the symptoms.
it pays to plan ahead. In this case, getting some on-campus dorms available for the Bear River Health Department.
I was staying in a 6-person dorm.
For Bridger Gunnell, this stay on campus was a bit unusual.
And so it was pretty large, but it was just me by myself.
He was staying in the Bear Lake area when he first noticed symptoms and tested positive. But going home didn't seem like a great idea because his dad works in healthcare.
And he works with a lot of elderly patients. And so we were trying to figure out an alternative way.
Trying to isolate from people under the same roof isn't easy. His parents were trying to figure it all out.
They were going to put a plastic covering over the door and have me sit in a room just by myself.
And that's where that dorm room comes in. Gunnell stayed there alone for 9 days. Staff brought him meals.
So that was really nice.
Emergency response coordinator at the Bear River Health Department, Mike Weibel, says those dorms have come in handy for several families.
We have real narrow parameters as far as people can be put into it.
The preference is always that people isolate in their own homes.
But there's always going to be that one instance where they don't have a home to do that in.
And it might have worked out fine for Gunnell at home, but he's just glad.
It definitely was a relief.
That he didn't have to find out.
And Bear River Health Department will lose access to those dorms towards the end of July. They're looking for another option to keep it going. And Weibel wanted to add, by the way, he says you can avoid a lot of those cases if you wear a mask, wash your hands, social distance. Back to you.
Yeah, I can't stress that enough. Mike Anderson live for us this evening. Mike, thank you.